Hey guys, it's Erin from Metasolv here to talk about the Inpatient ExRad eCQM, which is a new measure that CMS is including in your Inpatient Quality Reporting or IQR program. Now, CT scans obviously have revolutionized medical treatment and diagnosis, but they also expose patients to ionizing radiation, which means they could have an increased risk for cancer. So that's why CMS developed this suite of ExRad eCQMs to help emphasize the importance of radiation dose management. So this new measure is available to submit in the IQR program starting in 2025, but available at Metasolv now in 2024. It's designed to help quality leaders track and improve that performance of diagnostic CT use. So the ExRad eCQM is also known as CMS 1074. It calculates the percentage of CT scans that either had an excessive radiation dose or had an inadequate image quality. So it's an inverse measure, which means you do not want your patients to get into the numerator population. So let's start by reviewing those populations. The initial patient population, or IPP, includes all patients with a qualifying CT scan performed during the reporting period. So the patients must be 18 years of age or older and receive a CT scan during their hospital stay. The patient's scan must have a CT dose assigned to it and include an image quality category. The patient does not need to be admitted or discharged during the reporting period. Just some part of that encounter has to cross the reporting period. The denominator is the number of encounters from the IPP with a diagnostic CT scan performed. The CT scan must have an assigned CT category, a size-adjusted radiation dose value, and a global noise value. Now, the global noise value refers to image quality, and poor image quality may require additional scans, which is why they want to measure that one. Patients are excluded from the denominator if the CT scan was done on the entire body. It was a full body CT scan. And finally, the numerator is a patient encounter that qualifies for the denominator population, is not excluded, and has either a noise or a dose above the listed threshold. And the thresholds for noise and size-adjusted dose vary based on the specific CT scan category. Now, something to note is that for the very first time, a separate translation software is needed to convert that data from your PACS and RIS systems into an eCQM readable format. To do that, you'll need to install this free software from Alara Imaging Software. So it's important to start tracking and improving your performance on this measure right away, because there is a separate version of this ExRad eCQM in the outpatient quality reporting program. And that one will be required starting in 2027. So the sooner you can get started in getting that Alara software installed and tracking it on the inpatient side, you'll have a better chance of performing well on the required measure on the outpatient side. So hopefully this has helped you a little bit understand the ExRad eCQM, and more information is available on our blog page.